Hello, this is Michael from CharmHealth. I am the manager of the support team, and here I am today trying to show you how CharmHealth works within our system. This is a 101 course for which we try to cover the various aspects of how Charm works. This is mostly for new users, but I will cover some interesting and advanced material. But these are the things that I think most users should need before they start using CharmHealth. What will we cover? We will cover various aspects in the facility settings. We will also cover the procedure codes. We'll also cover some things in the calendar settings as well. The SOAP template will also be how those could be used, and also questionnaires and consent forms could be how we could use those as well. I will also cover how to use the calendar and telehealth, and how to go through your encounter. Additionally, while through this, I also will show you how to pull information from your questionnaires into your encounters, and through your SOAP templates. So, without further ado, we shall try to continue this process, and I will show you how to do various things within Charm. When you are first log into Charm, you first see this section. This is the main menu page, and a lot of the configurations need to be done in this area called Settings. Often we refer to Settings here, and it's like this little gear button right here. If you click on the gear button, it shall open a new tab, and then you should see the various things within Settings. Okay? Alright. One of the things that you're going to need to configure is the contents in Facility List. Inside Facility List, we have your facility should be listed here. The initial facility for which you put in your information will show up here first. If you want to edit a facility, you click here and then Edit. You could also go here and hit New Facility to put in your various information. Let's try to go look at the information for setting up a new facility right in here. The information facility name is a mandatory field. Each facility must have an address. For setting up EPCS or ERX, and also information when sending out claims, the information from this address will show up there. Same for the rest of this, like zip code. Time zone is a field that's useful for when you're doing videos, because a lot of people like to just work in telemedicine nowadays, ever since the pandemic. The fax number is also a mandatory field that is often used for setting up EPCS, and so is the office phone. The rest of this stuff is very useful for other things. You could also put in your NPI for your address that is associated with your facility here. If you need to add more lines for various other things, you can do that in here, as needed. If you need it set up for providers, I'll show you where there's another place where you can do that. The next thing we need to cover is facility members. Facility members you see active members and invited members here. The active members here are the ones that have been confirmed to exist. The invited members have yet to have been proved to exist. You'll also notice here that it says a role. We will cover the role a bit later. One of the important things is about roles is the practice admin. The practice admin is the owner of the practice. There can only be one. We understand that this is the owner of the practice in terms of the Charm's contract with you. Keep that in mind and do not take the practice admin role lightly. So, if we want to add a new member, we can go into Settings, Facility Members, right here, right where we are, and then we could hit Add Member. You need to put in a first name, last name, and email. The email address for the facility member cannot be used for any other Charm EHR or PHR account. The role, you can only select which roles we already have. You can't make up a role on the spot over here. And the facilities that they're associated with are listed here. So you can make it only associated with one facility if you need to, or only one facility. After you hit add, your facility member will show up in invited members. They will only be displayed as an invited member until they accept the invitation. If for some reason they lost in their email or they deleted it or something, you're always welcome to re-invite the member or delete them. Additionally, you could go and delete a member if you go here, and we have the option to delete. We could also make them inactive or reset their password. Or you could also configure the two-factor authentication preferences so that you can make it put in the pass. You could turn on or turn off two-factor authentication. This is a very useful feature to manage various things. The practice admin cannot be deleted. They are the owner. Next, let us go into settings, facility, roles. This is the roles section. The roles section defines what a facility member can or cannot do. You could include multiple roles for a facility member, but I often recommend, unless it's the practice admin, that you only have one role per facility member, so you have it down quite easily what that facility member does. We could try to edit an existing role right here if you hit here and then hit View Edit. You're also welcome to make a new role and by clicking here if you want to have a role with a specific name for a specific user. Most of these are the default roles, but you're welcome to add more roles as you see fit. Let us go create a new role. You need to put in a name. This is what will display when you look at the role. If the physician looks at their role, place where I am here, and I can see the role here, and it says practice admin, office manager, master physician, whatnot. These are the roles associated with this particular user. All the users will see this on their side, whatever roles they have assigned to them. The role description will only show up in the roles section. And then the base role over here, this will show what are the default boxes that are being checked off. So if I hit select staff, that means the permissions of a staff member will be automatically selected, and I could give other aspects of the role configured here. So see that the demographics just highlighted? That's because I selected staff. So let's go scroll down. Most of these I think are pretty self-explanatory, but there's some of these that are a little bit not as well understood that I often hear people ask about, so I will cover them here. So here we have the encounters. This is a very important section that people need to cover. It's the part of the this is part of the role for which they can or cannot do encounters. Notice that doing soap notes, prescribing medications, and ordering labs and images are all piled into one permission here. The rest of these are separated out so that people who aren't particularly providers, but someone who might be a staff who assists, could just have these permissions associated with it. But they are not allowed to sign encounters. They could start an encounter and edit it like a nurse can, but not necessarily be able to prescribe medication. That's what this is for. We could also make it so that you could, edit procedure, show the procedure charge as well. So, let's go here. Documents. One interesting thing people didn't notice we added recently is that you could sign documents now. We could add this as permission so that documents can be addressed and signed by this particular user with this permission. This permission here, appointment booking, we're making this for a staff-like member, so we're not going to be able to book them. But Appointment booking is not the same as creating an appointment. They're two different things. Appointment booking refers to the ability for this person with this role to be booked. Keep that in mind if you select this permission. Analytics, if you want it. So some people get confused by like the calendar practice access and personal access. If you want them to be able to configure the practice permissions for the calendar, you could have this turned on here. If you want them to be able to do personal access, you could also give them like able to like edit their own just edit for themselves, their own personal use. So that's kind of like the interesting differentiation we have here to be able to manage things. We also have things for practice access and personal access. You could edit all the members, or you could only edit yourself. Scoped access. Sometimes, most of the time, when you just turn on everything, it gives you the ability to do the most amount of things. Scoped access, though, is the one permission that restricts what you can do. So be careful with scoped access. Um, the in-house care team is part of the patient file, and if the person is listed in the in-house care team, they can see this patient. If this is turned on and they're not in the in-house care team, they have no record that this patient exists at all. Keep that in mind. So this is also another restriction to restrict fact if you haven't seen this patient. Also restricting private encounters that are accessible only to the consulting provider. So you can't. Yeah. So this is in order to prevent people from viewing each other's charts, if that is something you need for your practice. I think that pretty much covers the role. When you go into the kiosk setup, you can add a new kiosk to be accessed from an iPad within your practice. If you have an iPad when you're in your practice, they can answer questionnaires from on an iPad in your practice in the waiting room. That's the idea behind this. Do not make this. This is not for patients answering these questions within their own house. This is not what this is for. But if you're like a traveling person, I guess you could like do it in that case. But other than that, generally no. You could hit a new account to create a new user. Make sure you don't use your email address in here. Just create any other username. It doesn't have to have an @ in it. And then put in the password twice. And make sure you have this default selected here so you can use this in an iPad. Here, let me show you some miscellaneous resources. Facility resources. This is where you can show various like rooms within your practice, or just some sort of location where you could define what where a visit is taking place. You might need this, but you don't always have to use it. It's part of an auxiliary feature. Another miscellaneous feature is the fax. If you have enabled eFax, your fax number will show up in here, and this will be the fax number for which people can fax numbers to you. It includes the 1 for showing that you're in the United States. Another feature here is the scanner. If you have your scanner set up, you will get the scanner, like if you have the scanner add-on, you will be able to see this as the defaults here. You could define what the file format is, PDF or PNG or JPEG. And you could also, so this is what's used for like when you're scanning a document into Charm with the integration. If you are just like uploading a document from your Charm account, that's like just normal. That will just upload whatever file it's in. This is for like the scanner integration feature in particular. So the scanner only works with a Twain compatible scanner. So just keep that in mind if you plan to use our scanner add-on. One of the first things that you're going to need to do when you're configuring your Charm account is going to need to be able to add your procedure codes. Adding your procedure codes, you need to be in the settings section, as I showed you before, and then scroll down to the billing section. Under the billing section, you see a place where it says procedure codes. Your procedures can be added in here. If you're going to be using our billing section at all, make sure you add your procedure codes. Sometimes your procedures will not be here by default, so make sure to add your procedures here. You have two ways to add them. One of them is by hitting here and hit plus procedure code. You define your code in here. You define your description in here of what will show up in the invoice. The charge will show up here. The discount, if you have any, will show up here. That's like the default discount. You could choose to leave this blank. The category. So the only one that matters is the non-covered service. If it's a non-covered service, that means it will not show up in the claim. It could be in the invoice, and if you generate a claim from that invoice, it will not show up in the claim. These are for the modifiers for your claim, or for when you're generating this invoice. And the place of service. You are welcome to modify this, but this is like for when you're submitting the claims. The default tax can be defined here as well. Well, not defined. Which taxes it's applied to. If you want to set up your taxes, I'll show you that a little bit later. The additional details can be listed here if you want to put that in the procedure code. The same information can be added here. If you go import export codes, and you need to put in a CSV file. Generating the CSV on a Macintosh with Microsoft Excel, for some reason the format does not work, so do not do that. Use numbers if you are generating this. It's like just the CSV, and then just it's comma, it's like the code, descriptions, category, charge, 4 modifiers, tax name, and place of service. Same thing as before, it's just you got to create this in a CSV, so you could add like 400 procedures at a time if you just want to do it all at once. Or you could add them one by one on the left by just hitting plus procedure code. Either one. You could also export a procedure, and you could see what the procedure would look, what something like that looks like. In billing settings, I recommend that you also define your tax. So let's see, Command F, then tax. So you can enable tax in the invoice, and you could also choose whether or not you want to apply them to procedures and products in here. And your taxes can be listed here, and you could define what your tax is here. So you hit here to plus tax, you provide a name and a percentage. This is very useful for when you want to, if you need to record your taxes separately within Charm. Also, when you're setting up Bluefin, you could define which your Bluefin settings are in here, and if you want to add your Bluefin beneficiary, you do that here. You could also add your PAX device in here. Next, we will be covering the features within the calendar. Let's go into facility timings, and I can show you how that's set up. In here, you need to define what your facility time zone is. You could define that here. If you need to display all time zones, you could click that here if you're working with outside the United States. Over here, we could define the working hours. These are the hours of when you open and close within these days. Your provider timings must be within the facility timings, so just make sure you just put your facility timings within the times that your providers will be working. Just make that within those time periods. Any breaks, we could deal with those later in another section. Okay? Let's go to provider timings. Yeah. Provider timings is where we can define when a particular provider is working. So you can choose a facility and you can choose a provider. Which provider works at which facility and what times a provider is working at those hours at a particular facility. So we could add multiple times. So we could do this 9 to 1, 2 to 6, or something like that. If I need to add another time, I could hit here, this little plus, and then it tries to add another one. If I need to delete a certain time, I hit this little X, and then it's gone. This little not working indicates that they're not working on these days. For the exceptions, you could add exceptions for days that you are ordinarily working when you ordinarily would be, or this particular person. And you could also add a time when they are not working on a time that they ordinarily wouldn't be. You're welcome to try to apply this to all facilities if you desire that as well. So this is just a feature so that you could have slightly flexible schedules if you don't have like a continuous schedule. If you're probably not having any regular hours whatsoever, you could just add the small number of exceptions if you're a really small practice. Next, we could go over the online appointments. Online appointments is very useful for when you're setting up your web and bed calendar. This will show where the practice can have appointments booked by the patient in the patient portal or the web and bed calendar. If we don't have this enabled, you won't see any of these other features. Keep that in mind. If you have Bluefin enabled, you'll have the option where you can enable card processing. This is where you select the time slots. This is where you select your visit types. If your visit types are not defined, I will cover that a little bit later. Approval for appointments. This is kind of a confusing thing. It means what approval for appointments means. Do you need a human being to approve the requested appointment? If you do not require approval, a patient requests an appointment, it's automatically approved. So you could either choose to, if it's not required, means you ask for it, you get it. Required for new patients means any existing patient, if they ask for it, they get it. Any new patient needs to be approved by some human. Required for all patients means every time a patient requests an appointment, someone needs to approve each and every appointment. Do not allow patients to book this number of time in advance and this many days in the future. This creates like a little time frame for makes sense for whatever your practice needs. You could set up define your pre-screening forms under settings and then questionnaires. You could define which pre-screening questionnaire can be filled out, but this only works in the web and bed calendar. If they do not, they can't use the pre-screening form in the patient portal. Just keep that in mind. Also, you need to be in the Flexi plan to use a pre-screening form. Keep that in mind. Let's go into visit types. So visit types are defined here. If you could choose to edit things here as well. So if I want to add a new visit type, we have various features. We have the visit type name. You have the appointment mode. Video consult is not visible to you if you are if you do not have our telemedicine feature enabled. The duration. The duration is where you put how long the visit will be within Charm. The charge. This charge field will not be visible unless you have the Bluefin integration set up. And with the Bluefin integration set up, you could define a charge, which will be the default charge that will be charged in the web and bed calendar. You could choose that. It also affects the charge from the patient portal that are defined in the same place. The default SOAP template, you could choose which SOAP template will automatically show up when the patient books an appointment associated with this visit type. The default procedure codes will be the procedure codes automatically associated with the encounter when you initiate this visit type. The color, this defines what the color will be in the calendar by default. However, I'll show you later, this could be configured elsewhere. Next, let's cover the web embed. If you want to create your web embed calendar, they're defined here. You could hit add new. You could only choose providers that have the online appointments enabled, as you cannot see them here. That show the facility details, yes or no, could be defined here. And this is the hosting website. Sometimes you will get an error message saying to add something to the hosting website. Just add like a new line for each instance of a website being hosted. When you're adding your new website, you need to click here and copy this. And this you need to paste into your website, and it's an iframe. That means you need to copy this code in here. It will give you an error message, probably, telling you to add something to hosting sites, but you could just hit here and then edit it, and then just add it as a new line in here. Okay? Okay. In here, we could go to event types, and you could define your events. You could just here and put in a new name for your event type. Whatever you need it to be. This will be for times that you are not working. That it could be either applied to an individual or an entire provider. Preferences. Information for preferences can be defined. There's the My Preferences and preferences for the entire facility. One of the useful ones here is appointment booking from the PHR. If you want patients to book from the patient portal, for you in particular, as the provider, you need this turned on. If you don't have this turned on, you cannot you cannot be booked from the PHR. If you're able to edit the facility, you're able to configure the search while booking an appointment, calendar slots. I believe most of the features here are pretty self-explanatory. Another thing that you will need to cover is the Google Calendar. If you want to set up a Google Calendar integration, it will you could set up two-way integration with Charm and Google. That way the calendar will send the appointments to Google Calendar, but it will not show the patient's information. This will only be used for you to access your appointments, and that's mostly what it's for. So you click I agree and then accept the terms, and then choose your Google account, and then put in your information here. Next, we're going to need to go into Schedule Rules. In Schedule Rules, you could set up specific rules for when a visit type number of visits that can or cannot be booked within a time frame. So I could go here, hit New Rule, select for a particular facility. Then I could also define it for a particular provider. And then I could sort of set that for this particular visit type, on days allowed, I could set it so that there are 0 of these appointments. So that means I can't do COVID tests on Mondays. That's kind of what it's for. It's to save your time. And then I could set it, I could define that I could do 5 on this day, and then 0 on these other days. And then that means I can only do these COVID visits on these particular days. That's kind of what it's restriction for. This is to be able to give you restrictions so specific visit types could be only done on specific days. Hope this is helpful. One of the things we need to do for setting up CharmHealth is that you're going to need to fill out your information in your templates. To edit your templates, we have templates here, My Templates, and Practice Templates. My Templates are templates that are only yours. Practice templates are shared with everyone in your practice. Email templates are templates that are the templates of the emails that are sent out by default. And the Charm library is a place where you pull various templates from. So let's go into My Templates or Practice Templates and create a new SOAP template, because SOAP templates are very useful. To build a SOAP template, go here and hit New Template. We have various types of templates here, but we will only cover the SOAP templates for now. Let's go create Test SOAP 101 for the Charm 101 video. When you're creating a SOAP template, it will show you various sections. This is asking which particular sections do you want to have show up in the in this template. If you hit past medical history, family history, whatnot, and review of symptoms. So we could just fill these out, and we could try to drop these components into these sections for demonstration purposes. Okay? All right. So we have various types of components that we could drop things into the various sections. You cannot add any of the main sections here. So like the ones that we just selected, they're the only, you can only choose from those. But however, you can add like a subsection of things like here. So we could just call this heading 1. This is just a heading is only for putting in words. And you could also use it to create like a subsection to divide things up. We could also go in here and put in a checklist if you need to. A checklist is, if you put in here, it does not have a question, but it only puts in various options. So I could just choose option 1, option 2, and you could choose from those various options, and then option 3. Please note that you could choose one or the other or all three, and that is what they could do, but it does not have a question. If you want to do a simple question, you could put this in here. And this is where we can put in the question. Where you can see where it says generated text, it's like this is the content of where the question is, and this is the content of where the answer will be. I could choose to put like a colon here, and then I could put in the answer. You could also select here to make it a multi-line question. You could also choose to make it mandatory or not, whether or not this is a question that needs to be answered for the encounter to be signed, or for the questionnaire if you're pulling it in to be finished. So it's the question, and then there's a text space for people to type this out. Next, we also have a single choice option. A single choice option means something could be true or that only one of the options is available. So let's see. Example of a single. So option 1, 2, and 3 are here. I could also choose to include additional comments and give the others option as well. Well, actually, no, let's not do the others. But you could include additional comments. So then, if I answer this, only one of these can be true. I can't select all of them. That's what a nature of a single choice is. here, let's go into the multi-choice. With the multi-choice, they, so I could also add hierarchical options here. Let me just give an example of a hierarchical option. So if I go ... and then option 2A, and then option 2B, and then I could also make a subsection. With here is where I could go option 2B1 or something like that. Then if I go here, I click here, and then click here, and click here if I need to, as I see fit. So that's what a multi-choice could be used for if you need to. You could also do this with a checklist as well. Note the difference between this and the checklist is that there's a question. The checklist doesn't have a question. The rating scale. Pretty self-explanatory. So just put in the minimum, maximum value, and then you just put an example, the question, and then the answer will be a certain number. You're welcome to use this as you see fit. We also have the notes section. The notes section is pretty useful. This is a place where you could just free type whatever you need if you want to. But recently, we've also added some other cool features for the notes. Notes could actually put in like information from like placeholder and then copy and paste it in. So I can make it pull information from various parts of the medical history if I need to. Copy and paste that information from there. Family history and social history. I can also go and just put in the patient's name, age, and date of birth, gender identity, and whatnot. So let's just go say here, copy this, Control C, or Command C, and then I could go and then you could just leave this as add a double enter, and you could like continue on from there. And this will auto-populate the patient name. That's what these are for. You could also use it to auto-populate the other things as I showed you before. All right. Another thing we can do is we could choose to add a table. Table is sort of like an Excel spreadsheet. We can put in the number of columns. And we could choose to add rows, to add more rows to the system. And we could also add columns. Anything in here that is filled in, you can't edit, but you will be able to answer fields that are left blank. Use the table as you see fit. If you don't need a particular section anymore, you're welcome to just trash it and leave it out. So now this information could be associated with this. So now this is good enough for our Charm Soap 101. We'll test this out later. You could choose to set default values if you want to. If you want, so if you hit no will do later, it will not allow you to select that. But let's just show you what it would look like if we did. So this, I could just choose to have the heading enabled. And I'll leave this blank for now, but you could choose to select the options you want added into your chart node. Okay. So let's hit save. For our next thing that we'll be covering, we're going to need to cover how to make questionnaires. If you're going to make a questionnaire, but you want to have it pull information from a SOAP template, make sure that you go into Templates, My Templates, and find your template. I'm just going to use the one that we created. And we're going to have to share it. It needs to be in the practice templates. If it's not in the practice templates, you will not be able to work with it in the questionnaire. So it's been shared. Okay. So now let us go to questionnaires. Settings, questionnaires, practice questionnaires. Let us make a brand new questionnaire. Let's just call it Test Soap 101 just to be redundant. And we can make multiple questions. So that you see where it says component widget. We have various things when we're doing a general questionnaire. These are components and these are widgets. Components are just words that are filled out by the patient, but they do not populate anywhere else other than the questionnaire. Widgets, however, are subsections that reference other things, like you only see the small section, but it actually contains more questions than is just what is visible. So personal details, contact details is like all the contact information, insurance details, allergies, medications, etc. We could also do things like reference a particular section of the patient's file. So I could choose history of present illness, and I should be able to reference the test SOAP 101 practice. And now the information from that could populate in here. And I could do past medical history, test SOAP 101 practice. So I'm referencing these. I could also make it reference a, question with options like we did before. Yes, no question, it's just yes or no. A label is just a bunch of words, a date, and I guess we could do a signature. A signature is something that can be signed. So let's we could just make this a basic questionnaire for testing purposes. So this is a general questionnaire, and we made a pretty basic one, but patients could answer these from there. Yeah, so we'll save this. Let us go send a questionnaire to one of our test patients. One way of several to send questionnaires to a test patient is go to Messages, then hit this little tiny arrow here next to Compose, then hit Questionnaire. And then we could look up the patient. Dennis Wood. And then look up Test Soap 101. Now we can send it to the patient. Now let us sign out of the Charm account because we can't be signed in to both at the same time. go to the PHR, sign in, and from there we could go see the new questionnaire that was sent to us. Test Soap 101 is here. The answers to the questions are here. And then here we can put in a signature. Very well. So now we have submitted it. Let us go back to take a look. Make sure you're signed out. Go into Charm. EHR. If we look from the patient dashboard, and then we go to patient details, we can look in questionnaires, and we can look at the Charm Test Soap 101. These answers were filled out. So now we can, if you need to reconcile information, you could hit reconcile here, and information will be reconciled. But we do not have an encounter just yet. Let us go to the encounter. In Charm, if someone is in your practice, they could book an appointment in the calendar section. First, there are various parts of the calendar. There is the list view, day view, week view, and month view. Also, here's the waiting list, the appointment requests, and reports. For now, we'll just try to show you how the day, week, and month view are, and how to book an appointment. So, we go here. If we want to look at a times, it could be sorted by provider view. We could also switch this up and put this in resource view. Resources are just like where you could set up your rooms. Week view, you could choose to sort them by which provider's times are available. Additionally, if you go into like the blue letters that say settings, you can configure many things. Among them, which provider's appointments you see, which resources are visible, and which visit types are visible. You could choose to change the time slot to be less time or more time. This is to give you a bit more granularity and show the images of things. Each individual user could also change the color of the provider or the appointment. I go here, update. It could also choose whether or not it's color-coded by visit type or by provider. So, let's go here and let's start an appointment on Tuesday at 11. And let us go select the provider. Alright, because this provider has the video media enabled, there's video consult as an option. If I choose the visit type, follow-up telehealth, you'll see that the appointment duration is 30, and now it's a video consult. This is the type of visit. Additionally, you could add these questionnaires over here. These questionnaires can be sent to the patient portal, just like I showed you before. That's another way you could get this done. All right, so let me hit confirm. Oh, I need to select a patient. All right, so now we have the patient. All right then. So the good way to start an appointment, if you are the provider, you need to go to the list view. In the list view, you could see the appointments that for this for this provider. If I want to switch it to like some other day, I could see that. But here we're working with Tuesday. We could also go in here, check the insurance eligibility if I need to. I can also go here, check the payer, review the face sheet, and I could also look at questionnaires that they have if I have the questionnaire associated with the visit. I could look at past visits over here. If I want to switch over, I could also scan and upload a document and associate it with I could associate it with this patient, and it'll show up in that patient's documents. Also, if you have Bluefin enabled, you could actually make it collect payments, as you know, whenever it seems fit, and this payment will be associated with the it'll be associated with the appointment, and the appointment will be associated with the encounter, and the encounter will be tied to an invoice, and that payment could be associated with that invoice. If I'm trying to do telemedicine, you click here, and then it'll give you the join URL. This is for starting the URL within Charm. This is the one for patients. This is like if the patient did not receive their join URL, or they deleted the email, or can't access the patient portal for whatever reason. This is a backup, means that you could send them over text or email or whatever, and the patient will be able to access this particular visit. Keep in mind that that this join URL is the same one, and it's tied to the appointment, and the appointment could be tied to the encounter. If you generate an encounter that just so happens to be around the same time for that patient, but not associated with this appointment, and then you do trying to do a Zoom meeting, it will be in a different room. So make sure if you're doing a Zoom meeting with a patient, you go into the list view, and then you hit encounter start. So let us start the encounter. So, when a patient does an encounter, we can try to pull in various information. I could choose to repeat, and you could repeat from previous things that have already happened. Additionally, let me show you what we can do with questionnaires. So we recently had this particular questionnaire. There's like these two answers that came from the previous one, and I'm going to hit reconcile. Now keep in mind, you're going to need to make sure you hit add, or you can select add all if you want to, just to save your time, because you probably might have more questions than that you want to answer. But you will need to hit preview, and then hit save. So now, if I go to the encounter, you'll see that this Test Soap 101 practice soap was put into the Charm account, and the answers were put in here as well. So that's one way you could end up having your answers populate into the. This is how you could get your answers to populate from a questionnaire into your encounter. Save you time, save you money. Additionally, you could try to add another item in the soap. You could add additional soap templates here, and the contents of those soap templates will show up. So I could do like an abdominal pain one, and then questions about relating to abdominal pain will show up in here if we need them. You could also go to hit Control F, then DX, and then you could look up diagnosis codes. Diagnosis codes are needed in super bills. If you need to have your diagnosis code in a super bill, you need to put them in the encounter. To add the diagnosis codes to the encounter, you go click here, Add DX. Then you could add your diagnosis code here. You could type in ASTHM, and then it'll show me the ICD-10 and SNOMED. So I could just choose the unspecified asthma, and then I could hit add. I could also look at templates for templates of my favorite diagnosis codes or diagnosis codes I use often. This is what you could do with this to create little groups of diagnosis codes that are useful to you. You could also go into past diagnosis codes and repeat a previous encounter, or you could choose to hit repeat all. Another thing that you would need for doing chart notes is putting in the procedure codes. You could choose to add a procedure by hitting choose from master list, and you could look up the procedure you need, or like query it in here to search for a particular procedure. You could also look up a procedure and choose from templates, and you could choose a template for which makes sense for you and your practice of specific procedure codes. You could select your package here, and you could change your fee schedule here if you need alternative pricing. These procedures could also be populated from where I showed you before if the visit type has a associated procedure on it. It will automatically populate in here for your convenience. In any case, you should make sure it's in here and hit save. If you want to start an encounter and have a video meeting, you're welcome to hit this button here. It will ask you, it will check the license and where the patient resides. If you have the information, if it doesn't correlate, you could hit yes. Then it'll remind you of just a discretion. And now let's go hit I agree. Okay, now Zoom will open here. When you are done with your encounter, you are welcome to hit save. This will save information. You could also hit sign. This will finish the encounter. You could also hit preview to look at the contents of what the encounter will look like based off the information you answered. Please note that any questions that are not answered will not display in the encounter. Just keep that in mind. So, once we're ready, we can hit sign. It will warn you that you cannot edit an encounter, but if you need to, I can show you how to override that. Your encounters will be listed here. So let's go look at all of the encounters. Here's the January 10th one. So see, there is no sign because it's already been signed. You could hit the button unlock if you need to go back to editing the encounter. If you do not see this option, go to Settings, scroll down to Encounter, and then Preferences. The Unlock option, make sure this is selected to enable, and hit Save to make sure that you can do this. Once you do that, anyone in your practice who can edit encounters will be able to unlock the encounter. Thank you so much for joining us at CharmHealth. We are very happy to help you with your various features in Charm. You're welcome to contact us on live chat. If you go to charmhealth.com and us at the bottom, you could contact us. Thank you very much.